Objective for today is mainly what I said, to exchange experience and overall to make information available, because already today we see that we can share a lot of experiences on similar topics that we are all facing in the cities on the COVID News platform. How can we make this information available for all of you so that you can know who to call, who to ask about what, and get more information? So that would be one thing. And the second is to enable support and cooperation. So the next step after exchanging information would be to really give physical or other ways of support and to cooperate in a substantial way. So my goal would be, because we will not be able to have a complete list as I send around with these 9 categories and subtopics covered in 120 minutes. We have more than 60 people, less than 120 minutes left, so it's not enough time. But at least I would have the ambition that each of us gets at least one important question answered today, at least to the extent to know who to call on this or where to look for further information on this specific topic. The second part would be to identify next steps that we should take. What other dialogues, thematic dialogues, should be following soon? On which topics should we gather the experts of the city administration? Should it be forum chairs hosting things? Should it be topic-wise? Which way should we do it? And what are the first priorities of those? And what other initiatives we should take? Should we develop further our existing tools like the COVID News? What other things can we do? So that would be the last bit of today's call that I would like to address. If everybody is fine with that, I would like to give the floor first to Milan in a minute, because you in Italy, of course, have been hit early and hard by the coronavirus. So you're probably a bit ahead of many of the other cities in terms of experience, how to deal it, of learnings, and can share this. And Olympia, you have agreed to share a bit of this. So I think that is very
Yes.
good for us to hear about that.
Thank you, Ivo, for the time, and thank you all for this opportunity to sharing experiences. As you rightly said, we have been somehow lucky in the very unfortunate time, because being the first region to be hit so hard by the outbreak, it meant that we received a lot of support also by Asian countries. So we had the opportunity to work with medical equipes coming from China, and we are constantly dealing with Korea to share best practices, especially for their model of progressive business continuity that they ensure to the country. I would say that numbers speak by themselves. So as a municipality, we are 15,000 employees, and the official lockdown started March the 9th. In less than 2 days, the municipality enabled the access for smart working to over 3,000 employees. One of the hardest decisions, first of all, something that I think is very important is to differentiate in between what are the competencies of the municipality and the one of the national and regional level. Unfortunately, we are not responsible for the health measures, so the Lombardy region is the one responsible for it. And everything that concerns the prevention of mobility and freedom for citizens regards the national level. So I think the hardest part wasn't the one of getting good example or being inspired by what to do and what not to do, but it was dealing at the national and regional level to coordinate all the outbreak. I would say something maybe provocative in a way, but I don't know if you noticed at the beginning, the position of our mayor was the one that Milano wasn't stopping. So this would would make it clear that we had not real the idea of the dimension of the outbreak, of the lethality of the virus, and how much it was already spread within the region. And this is because there was misinformation and gap of communication in between the regional and the municipal level. So what I would say is that, first of all, coordination among all the authorities is essential, both in terms of provision of materials and equipment, but especially in terms of setting up policies that might work well for the context. And this is very hard today. I would say that after almost 1 month of lockdown, the position of the mayor is the one of starting a progressive restart of some activities, but since, as I was saying, most of the issues are settled at the national level, for the national level it's easier to just say we extend the lockdown instead of ruling very sophisticated law that are based on the real condition of the different zones in Italy. Because at this time in Milan, we reached already our peak 1 week ago. So it's almost 1 week that our hospital have already the availability to host patients. In the mentality of Milan, I think that people are very willing to go back to work. We had a huge number of citizens that applied for volunteering. So I can tell you that we undertook 2 main measures. Some are fiscal measures. So we basically, for what concern our fiscal taxes, we interrupted them. So other taxes for waste and other municipal taxes were extended in terms of this expiration. And the second measures and the second fiscal measure within the mainframe of financial tools concern the creation of a fund. So the fund was launched 3 weeks ago almost, and we already reached 8 million euros. And we are still waiting to see how to deploy such amounts of money, because we first want to see what the Lombardy region and the national government will cover. The mayor is very much focused on the, let's say, the economic illnesses. So we want to try to inject finances directly to those families who will lose their job, or those families who will not make it to the end of the month. Already right now, for all these people that cannot get their meals, and they are not, let's say, they are inaccessible to supermarket because of their health condition or maybe economic condition. If you just call the municipal number, you will get somebody who is bringing the grocery shopping for you for free directly at home. So I would say that in terms of all the social assistance, our social policies department created a network in cooperation with huge NGOs as Emergency. Maybe also Francesco is online, can tell you something more about the food hub that we constituted with Emergency. But generally speaking, I would say that either in terms of supplies provision and in terms of social care assistance, we are right now able to cover all the requests at the municipal level. So I think in one way, reacting fast was key to contain the social and economic downsides of the outbreak. Also for homeless people and for, containing the risk of contagion, all the people that weren't able to have their private place where to stay for the quarantine were moved to hotels. So we had agreement to take one whole hotel that was already supposed to close. So the mayor took it, and all the people without a home can have their quarantine there. while Lombardy region, together with one of the main hospitals, was able to build in 10 days 100 beds for the emergency patient. So on top of the existing beds already provided by the hospital. As I was saying, I think that, and I will stop because I mean, I don't want to take too much the floor, and I'm also curious to know your projects and your reaction, and I will be more than happy to reply to your questions. But what I was saying, I think that the hugest bottleneck that we had, it was, first of all, we weren't really prepared and aware of the number of cases that we had at the beginning of March. So nobody knew that there were so many. And I think there were some delays, some huge delays in the Italian health system in identifying the cases. And this led to such a huge outbreak in the region. First consideration. Second one, and second bottleneck, is the difficulties of not being responsible for some policies like the one of health and like the one of mobility, which leads to the necessity of being 100% aligned with all the different authorities that have this power. And this is very complicated because right now in one country like Italy, where the outbreak started in a very different timelines, like South region are about to start their peak, are about to reach their peak, while we already reached it. So you really need to have sophisticated policy implementation, which are not that easy in our country. So I would say that these are the main bottlenecks.
We have, thank you very much, Olympia. We have some questions already for you, and maybe Julie, you could summarize those that have been asking questions in the chat.
Yes. We have questions first from Raoul about the fiscal measures that Milan developed. So he didn't really understand. Are the tax cancelled for this period or just postponed? That's the first question. And Olympia, could you repeat the amount of the new funds that has been created? I think it's 8 million, but I'm not so sure yet. And then we have questions from Ian Catlow from London about the specific testing, the mass testing that are being done. Is it already possible to do the mass testing to look for antibodies or anticorps? And if yes, how do you think in Milan the lockdown could be relaxed? So specific questions on fiscal measures first and then on mass testing.
Okay, so in terms of fiscal measure, the tax waste was the expiration, the deadline for the tax waste was postponed to the end of the year. And yes, you're right, it was 8 million raised by private, and we are still receiving a lot of interest for, let's say, other financing by private or private association, or even the third sector and on loose, let's say, activities. So far it is 8 million, but we do assume that it will be higher at the end of the period. And to answer the question from London, yes, the test to identify anticorps is already on the market, but it never entered. Let's say that the fast testing on anticorps has never entered the EU market yet. So far, what is possible to do, and this is what the Veneto region is doing, is to identify the anticorps through a blood test. And this is, let's say, I mean, it's feasible, it's existing, but it's not fast. So what we are trying to do and to propose is to get the fast test on anticorps be experimented and tested from Korea in Milan, but as you might imagine, there are some bottlenecks also related to the entering of new products in the EU market. So there is the National Agency for Medicine, AIFA, in Italy, who should approve or not approve the entrance of such tool. To end and to get a better understanding of the expiration of the lockdown. I think I still have to reply when we do assume that the lockdown will be released, will be smooth. For what concern the latest update we have from Rome, though the mayor of Milan wanted already to start a progressive restart of the economy after the 3rd of April. So the mayor was proposing basically to divide the age population and allowing some layers of the population, like the young people, to restart their job under specific sanitary condition. But the reply that we got was that it was too complex to settle such a specific law in this way. So they decided to postpone the lockdown and to extend it up to the 13th of April. In this way, we want to cover the Easter celebration to make it sure that there are no gatherings among people. After the 13th, if let's say if the figures are still decreasing in terms of death and in terms of people and in terms of contagion, then we do expect to have softened the lockdown and start to open the bars and restaurants. Again, we are really taking the example of Korea, so we want to start some activities like bars and restaurants under specific conditions, so with number restraints, with masks that should be provided at restaurants. So everything should be done under a huge security measures. And of course, here the difficulty is to ensure that you also have, the security forces in place enough to control that all the people are respecting this law. There was a huge, let's say, there was a huge turmoil about the possibilities for moms to bring their children for a 1-hour walk during these days. And the government decided that only if the mom or the parent has to do grocery shopping, they can bring one child with them so that they can also have a walk, but it's still not possible to do any form of sport around, even around the corner of your house, and not walk in any condition that is not for your grocery shopping or for sanitary reason. So I think I reply most of the questions. Correct me if I'm wrong.
No, I think you did. There are 1.5 more just in the chat, which you maybe could answer quickly, and then we could maybe see what other cities can share, maybe starting with the topic of the lockdown and possible exit strategy. And one of the questions that maybe Julie you could take up in the chat is also related to how you want to do this in Milan, the exit from the lockdown.
Yes, first we have a general question from Joe from Glasgow. I think it's a question to all cities, basically, about when you think the peak has passed and how are other cities planning for relaxing rules and returning to work. So you already kind of responded to that. What do you think, Olympia, is the approach desirable? Is it business as usual approach? Is it achievable? What are other cities planning for scaling back up? So this is really focusing on the end of the lockdown. But that's a very general question for all of us, I think.
I think business as usual is out of question. I mean, we already expect our economy to contract by 6% in terms of GDP, and I'm not expecting to have business as usual up to December this year. Even in terms of our big events, we had this big convention on LGBTQ, we had World Roots, so we were supposed to host all big events and all these were cancelled. So we are just keeping events that will take place from end of October onwards and will not involve more than 200 people. So even in terms of the cultural and creative industries, business as usual is a word that I think we won't hear up to beginning of 2021. Even in terms of restaurants and let's say community activities, I think that we shall expect to avoid gatherings with other humans for let's say at least the next 2-3 months. So we do expect to be back to a kind of normality maybe in September. We hope so. But before organizing huge gatherings as marathons, public events, and etc., I think that we have to wait a lot of time.
There's another question from Roel. What about opening bars and restaurants? Are there already talks about that in Milan? And is it a national or a local measures to be taken?
Yeah, as I said, this is still, unfortunately, is still at the national level to decide. But as soon as we, after the 13th of April, so soon after Eastern time, we will have the agreement by the national level to rule on the restart, on the progressive restart of the economy. Restaurants and bars are supposed to be the first one to reopen. And as I was explaining, we are following the Korean model, so we will have very limited number of people that will be allowed to enter the bars, and they will need to keep distance, at least 2 meters distance from each other. So even if you want to go, this is what we are discussing. So don't take my words for 100%, let's say, sure. But I don't know if you had a look to what Korea and China did with this plexiglass screen to divide one guest to the other one. And so we are trying to follow with this example, but for sure, instead of extending far more the lockdown, we prefer to have a progressive restart.
Okay, we just have one last question from Joan from Terrassa. Back to the private fund of 8 million. He wants to have the confirmation that it's a fund coming from the private sector.
Yes, it is just from donation. So just people that wanted to donate to give money for the city for the outbreak. And as I was saying, there are still many stakeholders, big players like banks or financial institutions that want to give more money to the fund, but they are waiting to see where this money will go. So we expect to publish a call with all the details of the money employment in 1 month's time. So as soon as we will publish the call to say, okay, now we raise, let's say, 10 million of the fund, we will employ this money for X, Epsilon, and Z. Who wants to further participate should give this amount for this and this and this, and then we do expect to raise at least to double this amount.
Okay, so this also partly responds to Stéphane from Toulouse, who wants to have more details on the 8 million fund. Stéphane, let us know if you need additional information, or feel free to be in touch with Olympia from Milan. I think that's it for the question.
Thank you very much, Olympia, for that information. I think it's, as we said, you're a bit ahead of most of the other cities, also probably in terms of thinking about an exit strategy and about the progressive restart.